Hello, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything education for pain management. Today the topic is platelet-rich plasma injections for epicondylitis. Platelet-rich plasma goes by the shortened version PRP therapy and is a regenerative medicine injection that has been showing great results in various musculoskeletal conditions. It's been used for decades for cardiovascular, ophthalmology, urology, and wound care conditions, but over the last few years it's finding its position in the treatment for various musculoskeletal conditions. One of those is epicondylitis. Now, there are two types of epicondylitis, those that affect the inside of the elbow and those that affect the outside. The outside epicondylitis is referred to as tennis elbow, and the inside is golfer's elbow, because those are the typical sports that are associated with those movements. Okay, it could also be called housekeeper's elbow, weekend warrior's elbow, weightlifter's elbow. It's very common when you get into your 40s through 60s, and one of the problems with it is it can be very difficult to treat it because it'll go away, come back. Sometimes it'll stay for like over a year. It's really annoying. Less than 10% will go on to end up needing surgery for it, but it can just be a persistent issue. And what happens is initially it develops tendinitis. Okay, it's an inflammation of the tendon area, which is where the muscle inserts into the bone. Okay, but as it doesn't improve or get better, it can fall into what's called tendinosis, which is where it's more just degenerative changes as opposed to active inflammation going on. So the usual treatments of anti-inflammatories and steroid injections sometimes will work wonderfully, other times they won't touch it. So a recent study looked at this, and looked at over 30 patients at a southern Florida orthopedic clinic, and basically they injected, it was both, medial epicondylitis and lateral were included in the study, various ages, males and females. And these are patients who had failed at least 6 months of conservative treatment, which included physical therapy, anti-inflammatories, steroid injections. The only next treatment that they would have in the usual treatment realms is surgery. Okay? So they gave them each one injection of PRP therapy. Well, what is PRP therapy? Essentially, it involves taking some of the patient's own blood from a simple blood draw, and they take that blood and put it in test tubes and spin it in a machine called a centrifuge, which goes really fast, for about 6 minutes. And then what you end up with is 3 separate layers. And the top layer is PRP. Has a lot of platelets in it, has a lot of growth factors in it, and that's what's used for the injection. In this case, they took 3 cc's and they injected it in the problem area, whether it's on the outside or the inside of the elbow. And they said they used a pepper technique where they just poked it into various areas once the needle was in place. Okay? Now, what happened? Well, they looked at a lot of different things. They looked at pain levels, they looked at functional activity, and they looked at it for a whole year. And what they found is that across the board, patients got a lot better. Only 2 ended up going on to need surgery. 3 patients fell out of the study, but when they called them, the patients actually said, you know what, my pain's gone, I didn't need any further treatment, and I didn't need surgery. So that's a big concern, is when patients fall out of a study, is it because the treatment wasn't good, they didn't get better? But in this case, they all got better, of those 3 that dropped out. So really there was only 2 that ended up going on to surgery, and those were high-level competitive athletes who didn't see a lot of improvement at the 1-month mark and said, I need to get back to competition faster, so they opted for surgery. But the other 28, 29 of them, vast majority got significant improvements in both reductions in pain, increase in functional ability, getting back to the sports that they wanted to do, or the activities, whatever it might be, gardening, running, just housekeeping things. So they had a lot of improvement, and the PRP was very helpful when these people had no other options. They'd done it all. Okay? So PRP is very helpful for a lot of soft tissue conditions. And this study looked at the elbow. There's also been studies looking at the rotator cuff. There's also a recent study looking at arthritis at the Hospital for Special Surgery. They showed that the vast majority of those patients that had mild to moderate arthritis with pain got a lot better with functional activities and with levels of pain. So PRP is very exciting. It's low risk because it's your own blood. Okay, it's an outpatient procedure. It doesn't cost thousands and thousands of dollars. It's not covered by insurance, but it's not going to cost you $5,000. Okay, it's typically less than $1,000. Arizona Pain Specialist is offering this treatment. You can call 602-507-6550 to find out more information and to get scheduled. All right. Check out the website, preferredpaincenter.com. Lots of information on there. You check on the platelet-rich plasma. You'll read a lot that I wrote about platelet-rich plasma, the outcomes, the basics, and things like that. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.